if you are at the stage of life when Medicare is something that you rely on, you have a lot of decisions to make. And sometimes they're difficult to understand. Sometimes they can set you up for some financial hardships later. And so joining us to help make sense of your choices is Karen Early of the Blue Cross of Idaho. Thanks for joining us, Karen.
Thank you.
And of course, this is confusing for me. I can certainly imagine how it's confusing for the people who are taking part in Medicare currently. So just explain to us a little bit, when people get their coverage, there are some gaps, let's say, in there that could really affect them if they're not aware of them, correct?
That's right. Medicare has really good coverage. They cover lots of things, but they do have a lot of out-of-pocket costs the individuals have to pay, and there's no limit on those out-of-pocket costs. So you have to pay a certain amount of money when you go in the hospital. You have to pay so much when you go to every doctor visit. There are plans that help you with those costs and can cap the total amount of money that you have to pay out of pocket if you end up in the hospital or have some severe illnesses.
And so if you don't have those caps, you may have good coverage for the most part, but if something drastic happens, big major car accident or something, you could be stuck with thousands and thousands and thousands of dollars that you still have to pay, right?
That's right.
So what can people do? What are options? You talked about these caps. Talk a little bit more about how people can avoid, those out-of-pocket expenses.
Sure. Medicare Advantage plans and Medicare supplemental plans are the things that you can buy. This time of year right now is the one time of year any senior can buy a Medicare Advantage plan. It's called the annual enrollment period.
Okay.
So during this annual enrollment period, anybody can sign up for a Medicare Advantage plan. And there are a number of Medicare Advantage plans offered, and through private insurers. My company, Blue Cross of Idaho, does offer several Medicare Advantage plans, and there are several others offered. And they've got premiums. You pay the insurance company a premium, but you get access to the whole network of doctors that insurance company has. And one thing that's really tricky, that people don't really realize, that it can be difficult to get a doctor to accept Medicare if you don't have a Medicare Advantage plan. My mom moved a while ago. My mom moved, and she moved from one state to another, and when she went to find all new doctors, she couldn't get a doctor to take Medicare. When she joined a Medicare Advantage plan, all of a sudden she had access to a primary care physician, a cardiologist, and a pulmonologist. So there's more than there's the advantage of being able to get to a bunch of doctors, and there's the advantage of knowing that your out-of-pocket expenses would be capped.
And of course the doctors, when they make those decisions as far as coverage and everything, they want to make sure that they're going to get reimbursed from Medicare, so that's why it's often difficult for them to accept those patients.
Yes.
And the Advantage plan helps with that as well.
It
like
does.
You were saying.
Absolutely. You'll know that you'll have so much to pay for every doctor visit, maybe a co-payment of $20 or something in that nature. And then when you go into the hospital, you'll know that your out-of-pocket expenses will be limited. And the Medicare Advantage plans offer more than Medicare, though. That's the other thing about it. Medicare Advantage plans, almost all of them, by law, they have to cover everything that Medicare covers, but they cover a lot more. Some of them have vision, some of them have dental. They offer lots of extras, like lower amounts of money out of your own pocket for the various things that you need to do, plus health programs, wellness programs, and the support of an insurance company that helps navigate when things can get difficult. Because sometimes, as you know, when you get older, you get very, very complex illnesses. There are people in the insurance company that help arrange for your care, help guide you through the process. Without that, you're kind of on your own.
Yeah, and all for more money coming out of your pocket. So really quickly, where can people go if they're interested in open enrollment? Well,
Medicare.gov has a listing of all the places that you can get Medicare Advantage plans. Blue Cross of Idaho, of course, BCIdaho.com lists. We can go on there and look for our plan specifically. But Medicare.gov has a listing of all of them and a further explanation of what Medicare Advantage plans do, as well as Medicare Supplemental.
So Medicare.gov, a great place for seniors to go this time of year. Open enrollment expires December 7th.
December 7th.
So you got to make sure that you take action there if that's something that you think will be able to help you. So thanks so much for explaining some of those options for us this morning, Karen.
Well, I really want to listen to this now, because right now the open enrollment time for Medicare Advantage is underway. In fact, the deadline is coming up. And more than 70% of Gem State residents who are eligible to enroll do not actually opt in. So how do you know what is right for you? A lot of decisions should be made, and they need to be made pretty quickly. We're going to introduce you right now to Josh Jordan. He's with Blue Cross of Idaho's corporate communications. He's the manager of it. He's here to explain a little bit more. Very complicated subject, just Medicare alone, but you brought some numbers in to help us understand a little bit how it plays out in our state.
Absolutely. It is very complicated, and it can be a difficult thing for people to get through.
Yeah, let's talk about the thousands of people in Idaho with Medicare.
More than 200,000 people in Idaho rely on Medicare for their insurance coverage.
Now, this is Medicare alone. Now we want to talk about Medicare Advantage. Are people taking advantage of that?
Well, of those 200,000 people, roughly 70% of them rely on Medicare only for their coverage. Medicare provides a lot of coverage for services that people need, but it also has gaps in coverage, and importantly, there are no limits on out-of-pocket maximums that people have to pay. So if someone has a significant health issue, or maybe several minor health issues, there's no limits on the amount of money that they may pay for their coverage. Medicare Advantage plans also, you can find Medicare Advantage plans that provide prescription drug coverage, which Medicare Parts A and B don't provide coverage for, or vision coverage.
So Medicare Advantage is really to fill those gaps that you're talking about, the prescription drugs and the other expenses like that. Medicare will cover some, but you said something about the costs that they don't really rein them in.
Well, there's no out-of-pocket limits for the Medicare
limits, yes.
for Medicare plans. So if you have a significant health issue or several minor health issues, you're going to be responsible for paying all of your deductible, all of your coinsurance, and any coverage that isn't provided by that you would have to pay completely out of pocket.
So,
a Medicare Advantage plan is required to provide coverage, all of the coverage that Medicare provides, as well as filling in coverage in some of those gaps.
On an average, can you tell us how much a Medicare Advantage policy would cost per month?
Well, the average varies greatly, but at Blue Cross of Idaho, we can offer plans beginning as low as $24 a month. So it's a relatively inexpensive, affordable way for someone to protect themselves from some of those costs.
So with people listening right now, we need to talk about the deadline on this, because it is coming up.
Indeed. December 7th is the deadline this year, and if you wait until after December 7th, you can't enroll in a Medicare Advantage plan until next year, next fall.
So you need to make your decisions by then. Blue Cross is not the only ones who sell Medicare Advantage, but again, it's one of those things to fill the gaps of Medicare.
Absolutely.
Josh, you did a good job explaining it. I walked up to him and said, I don't really know much about this subject, so hopefully we asked the questions and got the answers that you wanted right there. Once again, the deadline for this Medicare Advantage, December 7th. We'll be right back.